We're going to start with Mark. He's at Sinai Hospital in Northwest Baltimore, where new policies for visitors take effect today. Mark.
Good morning, Christian and Ashley. Well, LifeBridge officials say they are taking a precaution to help stop the spread of the virus. Now, visitors may notice tents outside the emergency departments at some hospitals, although we don't see any tents here yet. Should there be a widespread outbreak of the virus, this will give them the room they need to screen a large number of people. Now, LifeBridge hospitals aren't the only ones in our area taking precautions. The University of Maryland Medical System also announced new policies for visitors at all 13 of its hospitals, as well as its healthcare facilities. Both hospital systems say all visitors must check in at the information desk. No one under the age of 18 will be allowed unless they're the parent of a child in the hospital, and visitors will be limited to only one adult inside the hospital per patient. And LifeBridge Health officials say these changes will take place not only here at Sinai Hospital, but Northwest and Carroll hospitals, along with the Levendale Geriatric Center and the Grace Medical Center. Officials at both LifeBridge and UMMS hospitals say visitors also might screen for flu-like symptoms, so if you have a runny nose, a fever, and a cough, you most likely will be turned away and not allowed to visit. Now, health administrators also advise people who have traveled outside the United States to wait at least 14 days before visiting anyone in the hospital. Many nursing homes also are taking precautions as older people are at a greater risk to exposure of the virus. Now, UMMS officials say certain exceptions may be made for extenuating circumstances such as a patient who are kids, a patient who is dying, or one who's giving birth. Now, you want to make sure you check with an administrative officer prior to your visit to see if they can make an exception in your case. We are live in Northwest Baltimore. Mark Roper, WMAR2.